Good afternoon and a warm welcome to this session on how social protection can respond to the risks, vulnerabilities and opportunities of women and girls in crises. My name is Edward Archibald. I'm the lead technical advisor for STAR, which is the Social Protection Technical Assistance Advice and Resources Facility, and I'm the moderator for today's webinar. This webinar is the 11th session of the Aspect series organised by GIZ and socialprotection.org. The series relies on a World Bank framing defining 4 building blocks of adaptive social protection systems, and we aim to bring together experts and practitioners and foster exchange on a global basis. This webinar cuts across 3 of the building blocks: programs, data and information systems, and institutional arrangements and partnerships. So the content of today's session, today we'll talk about how social protection can respond to the risks, vulnerabilities and opportunities of women and girls in crises. And to do so, we have an excellent panel of speakers to present their perspectives on gender responsive social protection in crisis, who will then join a panel discussion towards the end of the session. To actively participate in this webinar, please pose your questions or comments in the question box as we go, and we'll try to feed them into the discussion. It's helpful if you specify if there's a particular presenter to whom you're directing the question. So please bear that in mind. Now, to kick off, I'd like to briefly introduce the presenters. First, we have Palak Rawal, who is a gender and social protection specialist consultant in the World Bank at the Social Protection and Jobs Global Practice. Specifically, she supports a safety net project in South Sudan by designing a gender-based violence prevention and response strategy. She's also worked with the Asian Development Bank and the government of India. We also have Stephanie Betengo, who's a social protection specialist with over 30 years of experience. She's currently coordinating the rollout and implementation of harmonized systems for delivery of social protection in Kenya. And in particular, a key aspect of this is the enhanced single registry for social protection. We have Alexandra Irani, who is a social development advisor at FCDO Lebanon. She works on social protection, gender equality, social inclusion. And prior to FCDO, she's also worked with UN agencies, international organizations, and academia. And then the final presenter is Lorenzo Ravelli, who's an innovation specialist at UN Women with the Women's Economic Empowerment Team, which is based in the regional office in Dhaka, for the regional office for Western and Central Africa. Lorenzo is currently focusing on the development of programs and policies which leverage innovative approaches, technologies, partnerships to address the needs of rural women and strengthening their economic empowerment and resilience to shocks. So that's the 4 members of the panel. Without further ado, over to you, Palak, to talk us through how the World Bank is working with partners in South Sudan on strengthening gender in social protection.
Thank you so much, Ed. Good morning, afternoon, evening, everyone, based on where you are. Very glad to be a part of this panel. Next slide, please. As we know, women and girls are among the most vulnerable groups across contexts, especially in times of crisis, be it the COVID-19 pandemic, war, displacement, or other fragile settings. Women and girls are disproportionately impacted by crisis, which often exacerbates the existing inequities. For instance, during COVID, women were 2.4 times more likely than men to lose paid work because they had to bear an unfair share of unpaid care work and were more likely to work in sectors worse hit by crisis. In education, girls were 1.2 times more likely than boys to drop out of schools. In crises like forced displacement, women have reported higher rates of gender-based violence and are disproportionately deprived of basic services and opportunities. Next slide, please. It is extremely important for social protection programs to take into account the specific needs and challenges of women and girls and to respond to them to be able to truly achieve their objectives. A vast majority of social protection beneficiaries, as we know, are women and girls, who are also among the most vulnerable groups in any context. Given the diverse needs and challenges of this target group, the program needs to consider these along the project cycle, starting from outreach all the way to evaluation. Therefore, a gendered lens to social protection is not an addition. Instead, it is a necessity for good technical social protection design. For the World Bank Group, it is a critical priority. For the first time, IDA 20 has a commitment on women's productive economic inclusion, recognizing its importance in accelerating economic recovery. The World Bank Group is currently also updating its gender strategy to reinvigorate the organization's work on gender. For social protection specifically, we have a large body of impact evaluations demonstrating that social protection investments close gender gaps in human capital, women's access to jobs, assets, and opportunities, while also improving their voice and agency. More recently, impact evaluations have begun to establish social protection's role in tackling more complex outcome areas, such as curbing gender-based violence, which we will speak about more later, shifting harmful social norms, empowering women, and building their resilience to shocks. So social protection is probably the only sector which can contribute to all outcomes of gender strategy simultaneously. Next slide, please. The World Bank Group response is focused on harnessing the potential of social protection programs to amplify outcomes for women and girls. This includes strengthening programs by increasing their coverage, reaching informal sectors where women are more likely to be employed, bridging gaps in access to opportunities, while also increasingly adapting our programs to respond better to women and girls through intentional design and implementations measures all along the social protection project cycle. Now let us understand this using some examples of interventions. In the first stage of assessment, during outreach, we have multiple programs that secure early buy-in for women's participation through community engagement with norm holders. For example, in one of our programs, the team screens a video within the communities on the life of a couple that focuses on intra-household decision-making set in the local context. This is then facilitated by community dialogue, which has been effective. During registration, programs are closing gender gaps through alternative forms of identification, as well as digital and financial literacy training for women. In the second stage of enrollment, wherever possible, we try to pay benefits to women digitally and connect them to basic services and opportunities. In the third stage of provide, while providing benefits, our programs are increasingly focusing on accompanying measures or cash plus components to shift social norms towards greater gender equality. For instance, research shows that it is critical to engage men and boys in building support. Therefore, programs have been focusing on couples training and sessions with husbands or fathers to build shared objectives, better communication, and support for women's activities. Programs are now also tackling care burdens more systematically. For instance, some of our public works programs are building caregiving skills and exploring the provision of care services at scale. In the last stage of managing, more social protection programs are adapting their grievance redress mechanisms to effectively record and respond to gender-based violence cases using a survivor-centric approach while also increasing their focus on monitoring and evaluation. There are multiple entry points through program design and implementation in the project, as we just discussed. Even if your project design is finalized, there are still things you can do, and programs can increase ambition or complexity of these as their implementation capacity grows, as we've seen in many of our programs. Next slide, please. I will now spend a few minutes to share one detailed example from a safety net project that we've been supporting in South Sudan. South Sudan, as we know, is a fragile and conflict-affected country with limited capacity and resources. Gender-based violence is a significant barrier to human capital development and poverty reduction in South Sudan and undermines the effectiveness of social protection programs. About 65% of women and girls in the country are survivors of physical and sexual violence at some point in their life, with majority of them experiencing it for the first time before they turn 18. Incidents of GBV tend to be normalized and underreported for various reasons, such as survivors' fear of stigma and backlash, high rates of impunity, traditional beliefs like the normalization of violence, etc. The World Bank's Finance South Sudan Safety Net project was aimed to provide temporary income opportunities to selected poor and vulnerable households and to strengthen safety net delivery tools in the country. The project had three main components, as you can see on the screen. Next slide, please. As the project team, we knew that operating in a context with such high level of GBVs entailed significant risk. If we were not equipped to deal with it, it could affect our entire operation and significantly limit the potential of the program to achieve its objectives. So we started with first developing a GBV-sensitive grievance redress mechanism to respond effectively to GBV cases. This included measures like a separate workflow for GBV complaints, codes of conduct designed separately for cases against beneficiaries and cases against committee members, appointment of one female GBV focal person in every project committee at all levels, a toll-free helpline to report cases, trainings for all members on survivor-centered approach with refresher trainings at equal intervals, and strengthening referral pathways to GBV support services, among other building blocks, as you can see on the screen. Next slide, please. To build onto this, we later conducted a detailed analytical exercise to understand the prevalence, causes, and existing responses to GBV, as well as gender attitudes among different stakeholder groups. The findings from this helped us adapt our Cash Plus training modules, such as by including content on safe and unsafe touch as part of the module on early childhood development, content on joint household financial management under the module on financial literacy, discussing menstrual hygiene myths and facts as part of the module on water, sanitation, and hygiene, and much more such content to shift gendered social norms. This content is accompanied by gender sensitization guidelines and trainings for facilitators and an introductory gender and GBV module for all beneficiaries. The study findings also helped us refine our community engagement plan, focusing on engaging norm holders to build ownership for women's participation. Through such measures and more, the project in South Sudan has looked at the entire project cycle and identified opportunities for gender mainstreaming as well as GBV prevention, response, and mitigation. We continue to learn from this as well as programs elsewhere to refine and expand our work on gender responsive social protection. Next slide, please. Within the social protection and jobs global practice, we have developed a set of resources that we think can help. The Safety First Toolkit and e-learning course provide operational guidance on how to leverage safety nets to prevent gender-based violence, with practical design and implementation tips along the project cycle. The Women and Girls Empowerment Framework provides the guidance and tools to help task teams operationalize this agenda in social protection programs. We are also currently finalizing the social protection gender strategy and hope to share that with all of you soon. And lastly, we hope that these resources will be helpful as you further your work in this important area. Thank you, and looking forward to any questions later.
Wonderful. Thank you so much, Palak. Right, let's move to Stephanie Butengo to give some insights from a Kenya perspective. Stephanie, over to you.
Oh, thank you very much, Edward, and thank you everyone for joining this webinar. So yes, Edward has said, my name is Stephanie, and I will continue with the presentation. So just looking at what opportunities we have, or where we are as Kenya in terms of trying to address issues to do with women, girls in crisis, or gender in social protection. Please let's move on to the next slide. So as a way of introducing, I want to just recognize that the overall objective of social protection is to combat poverty, inequality, and vulnerability. And looking at that in terms of where we are in Kenya, then looking at our poverty trends, as of 2015-16, at least we were looking at 36.1% of individuals living below the poverty line. And inequality between women and men is widespread. So it remains really a major obstacle for sustained development in the country. So that just reinforces the fact that this discussion today is very critical for us in Kenya, just to see how we can be able to bring on board gender in terms of our different interventions, social protection. And very specifically, I want to note that within the country, we have a very fragmented system, and we have many, many different players, of course, doing different things, some of them touching on gender, but we need that harmonization. So that is why this particular session is very critical for us. Next slide, please. So yes, so looking at what our situation looks like, and I thought looking at different levels in terms of addressing issues to do with women and girls, dealing with risks and vulnerabilities, I thought, what does our policy say? So our policy, and we are looking at the Kenya National Social Protection Policy 2011, it does actually look at gender mainstreaming as one of those principles that we ourselves need to follow as social protection. But also when we look at the revised policy, again, it reinforces the same thing about gender mainstreaming. But one of those things that you will note is that it does not explicitly state, strategies on gender for social protection. So yes, we have this general principle that we will be able to gender mainstream our social protection interventions, but without very clear strategies, then we've just assumed that once we implement our different social protection programs, it is possible we are going to achieve some gender sensitive outcomes, which as far as I can see, has really not been the case. So again, even as we looking at our policy and reflecting on this particular topic, I do see a sense in which we need to review or to look at that policy and firstly, considering all the different stakeholders implementing social protection and, develop a coherence within all these particular policies, but more particularly actualize that aspiration of gender responsive interventions by explicitly being able to state, this is what we expect to achieve through social protection measures within the country. Next, please. So yes, in trying to reflect on this, I just said, let me look at the different programs that we already have and how they seem to be impacting on gender. And so if you look at Kenya, currently we have quite a number of programs. Most of them are really cash transfer programs. So I look at the HSNP, which covers food poor households within very specific counties, about 8 counties. Those of you are aware about our governance in the country. We have 47 counties. And within these 47, some of them are ASAL up to 23, but the HSNP program targets 8 counties. And here we are having the program targeting food poor households in that particular county. And then we also have the Orphans and Vulnerable program, together with the Older Persons Cash Transfer program and the Persons with Severe Disability, which are all implemented by the State Department for Social Protection. But generally, what I wanted us to see here is in sort of reflecting on it, we're looking at, if you look at the cash transfers, we have up to 50% of those beneficiaries actually being women, while 48% are men. So if we disaggregate that data, we can see that the programs, even though they are poverty targeted, are able to actually capture women within these particular programs. And then we have amongst the Older Persons Cash Transfer, which is a sort of a benefit to those persons over 70 years, we have at least 62% of them targeting women. And then of all that, in addition to all this, about 60% actually caregivers are women. So what we are saying in an aspiration of moving towards a much more engendered social protection intervention, these cash transfer programs already provide a platform for us to roll out gender-specific interventions, either in terms of vertical expansion or horizontal expansion. Particularly for these ones, because these are already ongoing programs, it is possible that we can be able to layer some gender-responsive interventions along these particular programs. So that is an opportunity for us as a country for us to be able to roll off gender-sensitive programs. Next, please. Again, just moving forward, looking at the same programs. Of course, I singled out this particular one because I thought the KSA project sort of puts us on track towards rolling off much more gender-focused programs. Now, if you look at the Kenya Social and Economic Inclusion Project, which we are doing jointly with the World Bank, with support from FCDO, we are having at least 3 components running under this particular program, but I single out the nutrition improvement through cash and health education initiative, which is basically a nutrition-focused program. But when you look at the burden of feeding a household, that burden lies on the woman. So much of the niche interventions are actually targeting women under this particular program. And then when you look at the economic inclusion program, again, which is one of the second components we have under the KSEP, this program also, as much as it is poverty targeted, we have seen, although I've not focused on the numbers there, we have seen that many of the beneficiaries who've been identified for this program are also women. And so what it tells me that, yes, we did poverty targeting, but increasingly we find that many of those identified to join these programs are actually women, and there is therefore need to consider what we can do in terms of getting positive gender outcomes from these particular programs. So I put here the third component, which has to do with supporting social protection delivery. And this is the non-single registry. I used this slide in my in the last webinar, but the idea is that we already are establishing a social registry. Now, the social registry would support us to be able to identify potential beneficiaries for social protection and enable us then to roll out various programs, including gender-sensitive programs in the country. So this is why I've put in the registry just on your left there, on my left, in other words. So if you look at that, you look at that we are able to collect data at a sort of global level in the country and consolidate that data and be able to avail that data for sharing from different stakeholders. What we want to ask ourselves, does the data we collect enable rollout of gender sensitive programs? And this is a discussion we can be able to have with stakeholders to help us improve the data collection we are doing, so that then we can be able to broaden the kind of programs we are having in the country, and most likely, of course, focus more on agenda responsive interventions as we move forward. Next, please. Yes, so now, again, one of the critical things that in my mind that we need to look at is how we can be able to support gender sensitive monitoring, evaluation, and learning. And I say this even reflecting on the social registry that we've just seen. The social registry has a platform for reporting. So how can we be able to embed reporting or an M&E framework within the registry? So that will be able to support us to provide reports for the different stakeholders. So that will enable them be able to build evidence that is engendered. So once we have engendered evidence, then it is possible to help stakeholders to roll out very gender-specific programs. And again, using the social registry we are looking at, and together with the M&E framework, we are looking at continuous collection of gender disaggregate data. And this will allow us then continuously to have a gender-sensitive analysis, planning, and programming. So until we have all these systems functioning optimally, it becomes very difficult for us to be able to roll out such programs. Another thing we're saying is that perhaps at the policy level, for us at the State Department to be able then to make decisions that are engendered, we need to be able to provide this kind of data so that policymakers are able to see how best then we can be able to utilize the resources that we have to roll out engendered social protection programs, either vertically or horizontally, which means we can be able to spread out across the different counties, but with very specific gender sensitive programs. And then of course, that I want to believe once we are able to provide these, it is possible to have better budgetary allocations to support our different interventions and also guide capacity building for engendered social protection programs for the different implementing organizations that we have. And again, for me, the M&E framework, together with the social registry, can probably allow us to build partnerships with the different stakeholders whom we would be working together with once this information is shared to the different partners. And I think this is where I want to leave it. Can I go to the next slide? Yes, thank you very much. please ask any questions. But what I was trying to do here is to try and say, yes, we've established some systems, we have already brought on board some programs, but we're asking ourselves, are they gender sensitive? How can we make them more gender sensitive so that we can be able to, fit into the discussion that we have today? Thank you very much, Edward, for this.
Definitely, thank you so much. Fantastic and very interesting. Alex is next, Alex Irani from FCDO Lebanon. In the meantime, please do keep the Q&A, keep the questions coming so that later on in Q&A we can address those questions. I can already see there are 2 questions in there, so please do keep them coming. Alex, over to you. Thank you.
Thanks, Ed, and hi, everyone. Very happy to be presenting today. Next slide, please. I'll be discussing gender responsive and inclusive social protection at FCDO with a specific case of Lebanon. Just quickly and broadly, the UK's international commitments on that front, national social protection floors adopted since 2012 in terms of SDGs. A priority for the UK is SDG 1.3 on ending poverty and 5.4 on gender equality. And also at the 63rd session of the Commission on the Status of Women, we did focus on social protection systems and how to ensure public services and infrastructure are inclusive and empower women and girls. Next slide. And so what are we doing about this in FCDO? First, we have our latest international development strategy that focuses on 4 key priorities framed around the 3 E's: educating girls, empowering women and girls, and ending violence. And so all of this, based on the literature, has shown that gender responsive social protection, does support achieving these goals. And so for the UK and for FCDO, policy priorities are expanding the coverage of social protection to close the gender gap, but also ensure that social protection is inclusive of all groups, not just women and girls, and also the intersectionality between gender and other areas of social exclusion. Second of all, working and focusing on strengthening policies and systems. And so also an approach the UK has been taking this year is that of patient development and also of focusing on working directly with governments to ensure sustainable reform and meaningful impact. And finally, creating opportunities to complement social protection instruments and programs with other complementary measures such as health, education, and GBV. Next slide, please. And so I'm going to zoom in on Lebanon. I'm based here in Lebanon, and it's a middle-income country that's going through one of the worst economic crises this century. And what we're trying to do is work directly with organizations and with the government to, again, ensure that we strengthen systems and we make sure the impact is sustainable, going beyond large-scale programming and financing. And so through STAR, what we've done is we've embedded 2 UN Women positions to work on gender and inclusion in social protection. This started last summer and is ongoing right now. So the 2 positions are an advisor and a field officer. What they are doing is, 1, strengthening gender equality and social inclusion, so GESI, in the main national poverty targeting program, which is housed at the Ministry of Social Affairs. Also embed themselves in all UN Women operations and check what kind of linkages they can do between social protection, livelihoods, basic assistance, humanitarian, and also the backlash happening against the rights of women and girls and other groups. And so providing programmatic support, knowledge generation, capacity building, and coordination. The officer does the same, but also with a more officer angle, field officer angle, so providing technical support, field monitoring on the NPTP program, and also supporting inputs on advocacy, knowledge building, and communication efforts. Next slide, please. And so I think the model of having 2 advisors embedded in an organization without having a program, so standalone advisors, has created some sort of opportunities, successes, and also challenges. So I think the main point we've seen in the past year is that it has improved coordination between donors supporting GESI in social protection. So with the FCDO funding the positions, but Norway and Canada funding actual GESI programming in social protection through mainly WFP, what we've been trying to do is make sure that the support from Norway, Canada, and the UK are complementing each other. And I think this is very important in a global context of reduction in funding, but also when we see duplication of funding and efforts. So this coordination is happening thanks to the fact that we have advisors without a linked program. Another interesting thing is the biggest organization working on social assistance and cash support in Lebanon is WFP. And given the large-scale operations and the complexity of the context, WFP has a lot on its hands to cover in terms of ensuring cash reaches the most vulnerable. And so the partnership that has started between WFP and UN Women on this and was also triggered by our support is that it allowed WFP to partner with UN Women focusing on GESI specifically in the social protection program, while WFP focusing on the implementation of the large-scale program. And so this has created a very interesting and fruitful collaboration. And another opportunity has been providing technical support and research support in ongoing programs and research pieces to ensure GESI mainstreaming. We know a lot of programs and research pieces are out there. They have a lot on their mind, a lot on their plate, and having advisors with the sole focus of embedding GESI throughout is having a multiplier effect. Now, of course, this comes with challenges, which is not having a program and not having your own funding means you face a lot of delays. Advisors have to run after organizations and their programs to ensure partnerships are set in place. And also the fact that we're working on systems building in a context of political paralysis and economic crisis means this is happening very slowly, especially that our government is in an ongoing public strike. And so having access to the ministry staff is becoming quite challenging. Next slide. And so just to show you a quick brief of what they're doing and how diverse their work is. So the main breadth of their work is focusing on setting up, I mean, this was set up, the WFP UN Women Partnership on gender mainstreaming in NPTP, the poverty program, but also in livelihoods, basic assistance, and food security programming. They also work on research with the ILO, working on pieces specifically on women's employment in Lebanon due to the economic crisis, and also how income security and adequate social protection is playing out throughout their life cycle. We also have a technical mapping requested by the Ministry of Social Affairs to map all of the social assistance and public and social nation and complementarity with programs. They're working on a development of an NME framework for Cash for Work program, and finally acting as a focal point for gender and GBV in the livelihood sectors. So we see that they are able to put on many hats, from partnerships, research, acting as focal points. Next slide, please. I'm going to quickly show one of the examples they're working on, which is the UN Women WFP 2022 partnership. And given the success of this partnership, we've seen a renewal of the partnership now in 2023, and now UN Women and WFP are about to sign an MOU for the next year. And so this partnership was based on 3 components: a qualitative assessment of the National Poverty Targeting Program. This was very important because it complements the regular quantitative post-distribution monitoring that WFP does and ensures gender and inclusion is taken into account. Second is training of ministry staff on GBV and gender concepts. And third is updating standard operating procedures of the ministry working on poverty targeting. Next slide, please. And so under the first component, the gender, the qualitative assessment, very interesting is the methodology was basically talking to beneficiaries at ATMs, holding ATM interviews, having key informant interviews with WFP staff, management, ministry staff, and also mostly talking with women and beneficiaries of female-headed households. And so the main findings from the research was on empowerment, agency, and decision-making, we've seen positive effects, mixed findings. In some cases, women were able to leave their very exploitative jobs, and they faced less shame getting access to support. Case management and referral, we found out it needed more support. Intra-family dynamics improved, and the risk of exploitation and abuse, we didn't have any cases at ATMs, but we understood that women were feeling unsafe at ATMs that were overcrowded, and so security personnel was put there. Next slide, please. Then
Alex, maybe just try to wrap up in about 2 minutes. Thanks.
Yes, wrapping up. Thank you. The training series, we had 25 trainings to all of social workers, and we've provided them with the basic principles of GBV and GESI. Next slide, please. And finally, very important is their approach. Next slide, please. The approach was evidence-based because the findings of the training to the social workers at the ministry and the qualitative assessment have led to the development of the missing standard operating procedures. Next slide, please. And also filling the gaps in the program, which is creating GBV referrals and training MOSA staff on case management, and also holding an impact evaluation of NPTP. So just to wrap up, having embedded advisors without a program provided big opportunities, and we were able to use an evidence-based approach to come up with the components of the phase 2 of the UN Women WFP partnership. Thank you.
Great, thanks so much, Alex. That's wonderful. I think I just saw a question coming for you, Alex, as well. So yeah, it's on the general chat. So that's something for once we finish the final presentation from Lorenzo Ravelli. Lorenzo, over to you now. Thank you.
Thank you so much, Ed. Thanks everyone who's joining today, and very delighted to be here in this webinar today to share some of the approaches and the innovations that we have recently developed at UN Women in West Africa around gender responsive social protection. And I will illustrate these approaches through 2 of our projects, one implemented in Senegal and the other one in Mali, where we have worked with both public and private sector partners to design and to leverage gender responsive social protection mechanisms, and in particular, insurance schemes that are better tailored to the needs and the constraints that are faced by rural women. And as we will see, these insurance schemes have actually turned out to be effective mechanisms, in one case to strengthen the resilience to shock and climate change of women farmers, and in the other case to actually also meet their unpaid care related needs. And as we'll see in the next slide, the first example is an initiative that we have implemented in Senegal with support from Global Affairs Canada, and which is known as the 3R program. So that is a global program to recognize, reduce, and redistribute the unpaid care work that is carried out by women, with a specific focus in Senegal for rural women. And as part of this program, we have adopted an evidence-based approach to really identify which are the most relevant, but also the most feasible measures, including social protection measures, which would enable us to support the government of Senegal to, like I say, recognize, reduce, and also redistribute unpaid care work. So here the idea was really to co-develop social protection and other measures that were not only tailored to the actual needs of the women there, particularly the rural women, but also that were relevant and feasible within the specific context of the country. And that is an important point, because if you think about unpaid care, there are really a range of possible measures that can be taken at the global level to tackle that. But really, we decided here to focus on what was feasible and how we could work with and tailor what was already in place as a starting point to tackle unpaid care in Senegal. So as you can see from this infographic, we have first carried out a quite thorough research phase, which allowed us to better characterize unpaid care work in rural Senegal and to identify what are the most critical needs of rural women around this. And this process also allowed us to identify what are the potential solutions through a dialogue, not just with the intended beneficiaries, but also with the government and the private sector. And as you can see on the right-hand side, we essentially identified 5 priority actions. First of all, the idea of developing an adapted health insurance model. And this is the one that I will go a little bit more into the details in a minute. But the other 4 that I will just mention here are strengthening childcare services for rural women, which also includes exploring some innovative approaches like community-managed childcare initiatives. And then, of course, investing in basic infrastructure, which includes health infrastructure, but also access to water, electricity, and of course, time-saving equipment for both domestic and productive uses. And then, of course, leveraging the opportunities that are linked to digital and financial inclusions. And finally, changing social norms. That's a very important point, of course. And we did that by starting to ensure that we can recognize unpaid care work at the community level by integrating this into the local development plans. And then we adopted a kind of a bottom-up approach, which actually led to a national policy dialogue on unpaid care. Well, let's go back to the needs very quickly. In the next slide, we will see the main findings of the research phase. And basically, not surprisingly, we all know that rural women carry out a huge amount of unpaid care work on a daily basis, up to 12 hours a day in some cases. Rural women, we found out they really somehow prioritize unpaid care work. And so that means that the unpaid care work really determines the little time that they can devote then to revenue generating activities. And so it really limits their income. And quite surprisingly, we found out that actually health conditions, not just their own health, but also the health of their family members, has a huge impact on their time use and really strongly hinders their ability to work. As you can see from the figures, half of them have mentioned that as a key challenge. And so next slide, please. We really decided to focus on that one and dig that a little bit, dig a little bit further on that one. And so we found out that rural women are actually not only interested, but actually willing to spend money on these instruments, potential instruments that could help them to distribute care work and strengthen their resilience, like financial and social protection services. And they were particularly interested in health insurance. Now, health insurance already exists in Senegal, but we found out that their knowledge and their access to health insurance was really low. Among the 200+ women that we surveyed, only 7% of them already had access to health insurance. And so that's how we thought, well, access to health insurance, if it's affordable enough and if it's tailored to the needs and the constraints that women face, that could really be an effective way to support them to redistribute their unpaid care work. And so, as we can see in the next slide, what we did is we worked together, we engaged in a dialogue with the Senegalese National Agency for Universal Health Coverage, which is called CMU, and we worked to adapt the supply and the delivery of health insurance services to the needs and constraints that are met by women. So the idea is really to allow them to easily or more easily access a system to redistribute their own paid care work through a better access to healthcare financing. So the approach that we adopted spanned 3 different components. We focused on tailoring the offer of services by making this more flexible and more affordable for the women, for the rural women. But also we strengthened their demand, their uptake for the services through capacity building. And finally, we also identified some community-based mechanisms to facilitate them to pay the premium, and therefore, which is going to be critical to ensure the sustainability of the intervention on the long term. So when it comes to the second component, so strengthening the demand, what we did is we worked through so-called relays, community women that are trusted women and that are trained to relay the messages and raise awareness. But we also worked on a different innovation which really allowed us to quickly target a huge number of women, and that is what we did as we developed basically mobile trainings in the form of audio modules that are accessible in their local languages, and they're accessible anytime via the mobile phone by simply dialing a free number, and then you can hear some bite-sized basically lessons on what is insurance, how is it helpful for you, and so on. And the result of all of that is that 1,300 rural women got to access to health insurance for the first time. And they could cover not only themselves, but also some of the family members, which allowed us to target 7,000, about 7,000 people in total. And we have prepared a little video about that, so we can hear the perspectives of the president of the network of rural women that benefited from this project. And she's Mrs. Korka Jiao. I'm not sure if the video is ready. Thanks.
Hello, I am very proud to be here as the president of the Network of Women Farmers of the North of Senegal, RIFAN. My name is Korka Joe. I'm happy to speak about the partnership that we have with UN Women. This partnership started back in 2018 through a very interesting program to support the economic empowerment of our women. But the second program that we benefited from in the past 2 years, the 3R program, is even more critical for us, for the RIFAN network. Before the program started, we were meeting several challenges, such as having to collect firewood to prepare and cook our food, challenges with processing cereals, like to crush or mill them, and challenges with access to health insurance. And the program removed all these barriers. This program brought us access to health insurance. Over 1,000 women, members of our network, could sign up to health insurance, and each woman could enroll up to 7 dependents, which allowed covering approximately 7,000 people in total. The insurance became more affordable thanks to group enrollment. The enrollment fee was decreased to just 500 francs for each member, and the yearly premium is 1,500 francs. You can't talk about development without healthcare, and this initiative, we really praise it because it brings us healthcare for us, our husbands, and our children. The access to insurance is therefore a key element of the 3R program for us. We also appreciate the way in which this was carried out because health insurance already existed before, but it was very difficult for us to access it. And this project came and made it more accessible and affordable. Before it happened that we got sick and we did not go to the hospital, fearing that they would ask us to buy medicines that we could not afford. Today, when you get sick, you're covered by the insurance, but there are rules. It's not as we could get up and go to the hospital every day. And even if I don't get sick for a year, during this time, other people in my family, my children and my husband, will have the opportunity to receive medical care. Even if we don't directly benefit from this, if other members of our family benefit from this, then it will still make an important impact for us. That's why we really appreciate this project. It allows us to work more, because when we are sick or we need to take care of our sick family members, we cannot work. Since we are 16,000 members in our network, we hope that UN Women will continue this important project so that all of our members can benefit from it. We, members of RIFAN, can really say that we get some benefits from this program and are happy about it. We thank UN Women and we wish to continue working with them. All we want is to make the life of rural women easier, especially of women that are at the bottom of the ladder, those who are tired because of the hardships and burden of their daily work, and those who need to be informed and supported to address their needs. This is our objective, and it is also the objective of UN Women.
Thank you. And so we'll now briefly cover the second example, where we have developed a similar approach, but there is a key difference here because we have been working with private sector stakeholders. So what we did in this project is we developed a gender-responsive crop insurance for women farmers in Mali. And as we can see in the next slide, what we've done is we've been working with our sister agency, UNCDF, so the UN Capital Development Fund, and we received support from Innovation Norway. And the idea here was to adopt the same evidence-based approach, but this time to identify what are the mechanisms that could strengthen the resilience of women farmers in Mali to climate shocks in particular. And so in a nutshell, when it comes to the needs that have been identified, next slide, please. We basically realized that one of the key challenges that women farmers were facing is that they really had to face recurrent income losses, which were due to drought mostly and floods. And that, of course, made them less prone to invest in improving their productive assets. And so that obviously was really limiting their incomes that they could make out of their activity. And so the second finding is that while a few agriculture and disaster insurance products already existed in Mali, these were mostly failing to address the specific needs of rural women. So they were really adopting a gender-blind approach. So like I said earlier, we worked here this time with a private sector partner, and following a competitive process, we decided to work with OCO, which is an insurtech, which is based in Mali, and they proposed to better protect women smallholders against droughts and flood risks in particular by adopting some gender-responsive innovations that would address their needs. And next slide, please. In a nutshell, what we did with OCO is we carried out a survey among the women farmers. And that was mostly to learn, for example, first of all, what crops were they growing, because women and men don't necessarily grow the same crops, but also what are the specific needs, what are their preferences when it comes to how we reach out to them, and so on. And so we found out that the best ways to adapt OCO's existing insurance schemes would have been to, first of all, better balance OCO's workforce by creating a team of female-only agents. And that's very important because we found out it makes a huge difference when male or female agents are talking to female farmers. But also we included the gender aspects, gender-related aspects in the trainings that were delivered to the insurance agents, of course, both the man and the female insurance agents. So, for example, what is the best time of the day to go and talk to women farmers about insurance? And also, we designed, or we supported OCO to design a new insurance product for a women-dominated crop, which is peanut. And in the next slide, we can see what has been the key results. So, as you can see here, the sales team that was composed essentially by women was much more performing than the other teams when it comes to reaching out to women. 61% of their customers were women, as compared to 17% for the baseline. Next slide, please. And as we can see, the peanut insurance product was really appreciated by women farmers. The majority of the customers of this are women. Next slide, please. And in this graph, we can really see the evolution of paying customers for the female team and the male team. And as you can see, really, this made the difference, and it allowed OCO to have more and more, to reach out to more and more women farmers. So essentially, next slide, please. Thanks to this project, and this approach, for the first time, 1,100 women smallholders got to access crop insurance for the first time. And I would add, and they paid for it, so there was no subsidy at all here. And of course, that also allowed to create new jobs for women in a, I would say, non-traditional sector, which is crop insurance. And really, OCO was able to reduce its gender gap by increasing the share of women from, I think, 18 to 25% in less than 1 year. So in the next slide, I will quickly summarize now some of the main key takeaways that we have learned through this project. So next slide, please. First of all, gender responsive and innovative social protection mechanisms must be tailored to the needs of the target women, but also must be really tailored to the specific context. And it works better if we can leverage the existing opportunities and initiatives, of course, from the government, but also from the private sector. Linked to that, this approach is not only, of course, obviously huge outcomes when it comes to increases the access of women to social protection and to financial services and resilience building mechanisms, but also they make a lot of business sense for the private sector, as we have seen for OCO. And so really the private sector, we think it has a unique expertise, of course, and it can be a very good partner to develop this kind of innovative social protection models, especially when it comes to insurance, of course. What they need, and where, as development partners, we can bring our support, is that we can really help them making their services, their business models more gender sensitive and more tailored to the specific needs of women in the case that we presented of rural women. So thank you so much, and looking forward to the conversation.
Thank you very much, Lorenzo. Fantastic and fascinating presentation and video. Right, so that concludes the presentations in the webinar. We've now got time for Q&A. So please do type them in the box. There have been a few questions that have already come in. 2 of them have already been answered. So if you click on that Q&A box at the bottom, you should be able to see what's open, what's answered. So 2 have already been answered, and they relate to, the first one was about designing realistic and holistic programs against GBV. And then the second question was about mainstreaming or targeted interventions. The one that is still open, and I might just pose it to the team now, to the panel, is whether there are any tips on how to persuade stakeholders to include gendered analysis, gender needs assessments in shock responsive social protection. And I think this is particularly interesting because as Darlene, who's asked the question, sort of highlights the issue of timeliness and concerns about perhaps the length of time that might be needed to conduct this sort of analysis, and whether that might delay some sort of response if it's undertaken in a short period of time. So I don't know if anyone wants to respond to that, Palak. Maybe you've got your camera on. So do you want to have a go at it?
Sure. Thank you, Ed, and thank you for the question. I do have 2 things I would like to say in response to that, and happy to hear if other panelists would like to contribute as well. So on the why of having a gendered analysis or needs assessment, I think one of the lessons for us has been that countries or regions with high levels of gender inequity, without relevant gender responsive measures, our social protection programs will not be able to achieve their full potential. And that often makes the case for including a gendered analysis and needs assessment to our stakeholders so that our programs can truly achieve the objectives that they set out for. And in terms of capacity constraints, time constraints, as well as other limitations, which often our implementing partners have, I guess it also then defines the kind of analysis that we can undertake. So with some of those constraints, what we have done is base it on existing studies and research. When there isn't enough resources to do a primary data collection, or even the need sometimes. But when there is a lack of data, which also happens in context, I guess we've done rapid assessments. We've also done extensive data collection. So I guess it depended on the capacity as well as the requirements for the kind of data that we were looking at. And those have been some different kinds of measures that we found a workaround in some of the contexts we work in.
Great, thanks very much. Are there any other panelists who would like to respond to the question?
Yes.
Stephanie, go ahead.
Yes. Thank you very much, Idon. And I think it's one big concern really about stakeholders saying, you know, can I be able to have an assessment on a timely manner? My sense is, can we have systems that are able to assess or to provide agenda analysis on a continuous basis? And that is why we were looking at, for example, you're having a registry that is able to collect gender data throughout. So you're not waiting for a particular time when you have an emergency to be able to say, now we would want to undertake an assessment analysis before we give you some information. So if you have this, you know, as a running sort of system, a knowledge management system that keeps on sharing with stakeholders, for me, that encourages stakeholders to be able to utilize that data in a timely way to be able to address vulnerabilities. Listen, just the other week, I think, is it last week, we were in a mission together with the WFP team in Kenya to provide emergency response support. So you'd imagine the emergency response was actually targeting a drought response, but we are providing that service now when we are flooding. Actually, Kenya is flooding now. So we're asking ourselves, what is the issue? Why didn't we respond earlier? Obviously, the information was already available much earlier, but in terms of resource preparedness, then the stakeholders who are giving the resources were not easily as prepared to be able to provide that resource. So being able to find a way of having, you know, information available to stakeholders on a continuous basis, so that even as they plan to already have that information, I think will allow us to respond much better. So for me, it's about what system do we put in place that is interoperable, that is able to provide information to different stakeholders. Yes.
Great. Thanks so much, Stephanie. Alex or Lorenzo, any if you don't have any responses on that, well, if you do, sing out. Yes, Lorenzo, go ahead.
Yes, Ed, well, I was actually typing the my personal answer in the chat, but yeah, it's not a universal answer, I would say. But you know, when it comes to insurance, for us, I think it was a little bit easier in the sense that there was a clear case, there was a clear business case for the private sector, because basically targeting your insurance business models and schemes to the needs of women opens you to a new market, which is obviously around 50% of the population. So again, that works mostly for insurance, but I think it could be a starting point for all of the other approaches. And you know, even despite that, for a private sector, it is easier to start with men. So that's what OCO did, for example. At the beginning, they only had 15% of women, but then with our, you know, we supported them, and and now they, you know, they were so happy about it that they were eager to scale up and continue this approach. So they could clearly see some business in it, you know, and so it's a win-win in that case.
Great, thanks. Lorenzo, just Stephanie was asking amongst ourselves, was your work on the agriculture, was it in the agriculture sector or social protection sector? How was it framed in that perspective, the insurance work?
So we have both. So basically, when it comes to the context, for our main interventions in West and Central Africa, when it comes to women's economic empowerment, in particular in the rural sector, we really are geared toward the agriculture sector, because that's where most women are. So we started in Mali with what we call the AgriFed program. So that's really a program that aims at economic empowerment of women through better access to, you know, land, financial services, access to markets and production resources, etc. And that's where we really found out that yes, this was leading to some impact for women, but every time that there was a crisis, a shock, particularly like drought or flood, like I said, well, they had to start again. So that's really where, for us, health insurance fits in. When it comes to Senegal, it's a little bit different, because we are really going a little bit further, and so we are combining these interventions to strengthen the income of the rural women to an intervention that really, like I said, aims at recognizing, first of all, but also at tackling and reducing and redistributing their unpaid care work. And that's where really health insurance was found to be an effective mechanism. That's on the programmatic level, but then on the policy level, we're also working with ILO, for instance, to mainstream social protection policies, integrate gender lens, and so on.
Great, excellent, thanks. Really, really interesting. Look, there no more questions have come in, so we can maybe I just want to ask, so we can close. Unless there are any burning questions, so please do write anything urgently. But if not, then I might just ask the panelists to sort of just give one closing thought as we wrap up. One top tip. You know, if there's one thing that you would like the audience to remember from this webinar, from the webinar, what would it be? So if I can just ask each of the panelists, we'll take it in order that was presented. So Palak first.
Great, thank you, Ed. So I think for us, it would be that something that I also spoke about in my presentation, but just reiterating that gendered considerations are not an addition to social protection design. They are a necessity to being a component for good social protection design. So when you think of good technical design, it should automatically mean that you take gender considerations into account. And there are multiple ways to do that, irrespective of what stage of program cycle you're at. Even if your program is already under implementation, there are things that you can do to improve that. So that is just one key takeaway that I would like to share, and something that we try to focus on in our programs and hope everyone else can too.
Thanks, Palak. That's excellent. Stephanie, have you got one top tip for the takeaway for the audience?
Yes, thank you very much, Edward. And I think I would like to speak to the fact that I think in social protection, we've pretty much been very gender blind. We sort of assume that if I'm going to target the poorest, whoever I get, men, women, and whoever, I shall be able to address what is. But I think there is need for us to now become very, very focused in terms of being gender sensitive in our outcomes, because then we'll achieve much greater outcomes as a sector. And I think increasingly for me, whether you're doing it at the program level or actually mainstreaming, depending on where you are at the different country level, I think we should not derail ourselves in terms of where we didn't start off with gender mainstreaming. We can be able to layer gender sensitive interventions within the programs that we have. But where we are starting new programs, in my mind, I think let's open up to mainstream gender within our interventions. And you know what? I think social registries provide a very, very good platform to give us enough data to help us now become very gender sensitive in terms of rolling out our interventions. So an interoperable system such as the registry and different registries, whether it's pharma registries, whether it is child protection registries, whatever registries that we're able to think about, let us focus on making them interoperable so that they're speaking to each other and they can help us be able to roll out very specific and focused gender interventions in our sector. Thank you very much.
Fantastic, thanks, Stephanie. Alex, have you got a closing thought?
Yes, thanks. I think my closing thought, and also based on what the audience has been asking, is no matter how we decide to integrate GESI in social protection, it's very important to take into account the views of other stakeholders and partners. Very important to be engaged with civil society, local actors, but also understand what kind of angle is needed. So for instance, as Lorenzo mentioned, like tackling economic performance versus talking about social norms, including fathers, husbands, any other members of the family that would help tackle the norms or anything that would be a hindrance in implementing it. So for me, there's no right or wrong. It's more understanding your context and coming up with a specific solution to that. Thank you.
Yeah, great. Thanks a lot, Alex. Lorenzo, close it out for us on the insights, the top tips. Thanks.
Thank you, Ed. So my final thought was also a little bit inspired by one of the questions. It was like, what is most effective, mainstreaming gender overall in social protection strategies and policies, or go for more targeted intervention? I think we obviously have to be very ambitious if we really are to change things. But at the same time, our experience really showed that you also need to build and to present evidence and to make the business case. And that's why targeted interventions really work out. And for example, in our case, it was really critical to leverage the existing opportunities and to map out the ecosystem. So that really gives us the starting point. It is really just a starting point, but really that's what helps you building momentum, and of course, building the business case and the evidence. And the final thing could be also to, not to overlook the private sector as a potential partner for gender responsive social protection.
Wonderful, thanks, Lorenzo. Look, there's one more question that's just come in from Arnold Chigabanga. And Arnold's asked, for continuity and sustainability, are there any tangible measures being put in place by the program? And I think this is directed at Alex in Lebanon. Any tangible measures being put in place by the program to ensure government absorbs or integrates the GESI advisor and the field officer role within their system?
Thanks a lot for the question, actually very interesting. So basically, given these advisors are embedded in a UN system, it would be very hard to integrate them in a government system. One, because the government would have a different recruitment mechanism and also different salary scale. And so this is not possible to do. Actually, other UN organizations have sometimes embedded UN positions in governments and ministries in Lebanon, and there wasn't a very good experience with that because there was no sustainability, and it created tensions between government officials and UN or international organization consultants and staff. But the important part, I guess, of this question is to ensure that the work that is done by these advisors, and this is what we're trying to focus on, is directly linked to what the ministry voices as their needs. And also they work directly with ministry staff to build their capacity, but also to respond to their needs and ensure that whatever they do is fully handed over once their positions are done, so that the government would be able to take it forward with its own current staff. Over.
Great, thanks, Alex. And thanks, Arnold, for the question. Dialing in from Malawi, I think. Great to see you. Okay, I don't think there are any further questions that I can see. So that brings us to the end of today's event. Thank you for having made the time to join us. Special thank you to our presenters. Thanks to all those who asked questions as well. If you're interested in learning more or collaborating on future work, you can reach out to the team at GIZ. The video from this session, as well as the presentations and summary of the discussions, will be shortly published at the webinar's event page at sb.org, as always, for these webinars. Please do take some time to fill out the survey on the webinar, and because your feedback does help us improve and pick topics that are relevant to you. And also just like to take the opportunity to tell you we're currently in the process of developing a guidance note on gender transformative social protection in crises that will be published in the next few months. And stay tuned for the final webinar of the series, which is scheduled to take place soon. The date's currently being finalized, so stay tuned. That'll be a preparatory webinar in anticipation of the Global Forum on Adaptive Social Protection, which is being held in Berlin in June. So thank you very much, everyone. Have a great morning, day, evening, and goodbye. See you next time.
Thank you, Edward.
Thank you.
See you next time.